You're turning 65. You're still working, and you think you're fine. Your employer has you covered, right? Maybe. But thousands of Americans make one small assumption and end up paying a Medicare penalty every single month for the rest of their lives.
Here's what nobody tells you. Having health insurance through your job does not automatically protect you from Medicare penalties. It depends on the size of your employer, the type of coverage you have, and decisions most HR departments will never explain clearly. In this video, I'm going to walk you through exactly what still working Medicare enrollees need to know in 2026. We'll cover what counts as creditable coverage, when you can safely delay enrollment, what happens to your HSA, the COBRA trap that blindsides retirees every year, and the exact steps to take when you do leave your job. Stick around, because at the end, I'm going to give you the one question you must ask HR before you do anything else. Most people never ask it, and it is the difference between zero penalties and a permanent surcharge on your Medicare premium for life. Let's start with the rule that controls everything. If you work for a company with 20 or more employees, your employer coverage is considered primary. That means Medicare pays second, and you can legally delay Part B enrollment with zero penalty. But if your company has fewer than 20 employees, Medicare becomes primary, even if your employer still offers you coverage. This is where people get seriously hurt. Someone joins a small business, they keep their employer coverage, they turn 65, and nobody tells them Medicare is now supposed to pay first. They skip enrollment, retire 3 years later, and get hit with a permanent 30% penalty on their Part B premium. In 2026, the standard Part B premium is $185 a month. A 30% penalty adds over $55 on top of that every single month for the rest of their life. Now, even if you're at a large company and safe from that late penalty, there is a tax trap hidden in your HR benefits package that could cost you thousands before you even retire. I'm talking about your HSA. Most people qualify for Part A at zero premium, so the common advice is to just sign up at 65 and move on. But if you or your spouse are actively contributing to an HSA, a health savings account, signing up for Part A, even at zero cost, is a mistake you'll pay for at tax time. The moment you enroll in any part of Medicare, including Part A, you become ineligible to make new HSA contributions. And if you are already collecting Social Security benefits, you are automatically enrolled in Part A, whether you want it or not. The fix is timing. You must stop HSA contributions 6 months before you plan to enroll in Medicare, or 6 months before you claim Social Security, whichever comes first. Because Part A can be backdated up to 6 months, and any contributions made in that window are subject to tax penalties. Wait, this next part is the exact moment most people think they're being safe, but they're actually walking into a financial minefield. It's the COBRA trap. When you leave your job, COBRA feels like a safe bridge, but COBRA is not considered creditable coverage for Medicare Part B. If you take COBRA and wait 18 months to enroll in Medicare, you don't get a special enrollment period. You have to wait for the general enrollment period, January through March, with coverage that won't start until July 1st. That's months without health insurance, plus a permanent late penalty that follows you forever. The same applies to retiree health plans. Once you retire, Medicare is expected to pay first. So what does protect you? Active employer coverage from a company with 20 or more employees. When that ends, you qualify for an 8-month special enrollment period to sign up for Part B without any penalties. But here is the crucial detail. The 8-month clock starts the day your employment ends, not when your insurance ends. Do not wait until month 7 or 8. Aim for month 1. Now, here is the one question I promised you. Before you make any decision, go to HR and ask exactly this. Is our group health plan considered creditable coverage for Medicare Part B? And does our company have 20 or more employees on payroll? If the answer is yes to both, you are safe to delay Part B while you are working. If the answer is no to either, contact a licensed Medicare counselor immediately. Do not assume. Before we close, here is your 5-step action checklist. Step 1, confirm with HR that your employer has 20 or more employees and your coverage is creditable. Step 2, if you have an HSA, stop contributions 6 months before any Medicare or Social Security enrollment. Step 3, only take Part A at 65 if you are not in an active HSA situation. Step 4, never treat COBRA or retiree coverage as a substitute for Medicare enrollment. Step 5, when you retire, enroll in Part B at the start of your 8-month window, not the end.
If you follow these steps, you pay 0 penalties and move into Medicare without a single surprise bill. The full Medicare enrollment checklist is linked right below. If you aren't subscribed yet, do it now. Next week, we're covering Medicare savings programs that could save you thousands. I'll see you there.